welcome everyone to the 2018 Vascular Discovery meeting being held here in San Francisco, California. I'd like to introduce one of our young scientists who will be speaking on a very important topic, not only for vascular medicine specialists, but also basic researchers. As I think you'll hear, it's the tip of the iceberg for what we'll be seeing in terms of type 2 diabetes and its effects on cardiovascular disease. So I'd like to introduce you all to Dr. Amy Shah, who is from the Cincinnati Children's Hospital. She is a pediatric endocrinologist, and today she'll be talking about adolescent onset type 2 diabetes, non-traditional risk factors for cardiovascular disease. Welcome, Amy.
Thank you. Thank you.
Tell me a little bit about adolescent type 2 diabetes. Is it different than what we see in adults?
So adolescent onset type 2 diabetes is different from adult onset diabetes, mostly in that it has a rapid onset and it's got a more severe phenotype. So adolescents with type 2 diabetes have greater insulin resistance, they have greater progression of beta cell failure, and they respond very poorly to current treatments, even more so than adults.
So it's like type 2 diabetes in adults, but on steroids?
Yes.
So amped up.
Yes, definitely.
Okay. And so what does that do for vascular disease in these patients?
Yeah, so it predisposes them to many of the complications we see in adults, but at a much earlier time. So there's data showing from large adolescent cohorts that there's already signs of kidney disease, there's already signs of peripheral vascular disease and eye disease. And within 20 years of having adolescent onset type 2 diabetes, these adolescents are developing severe complications, amputation, need for dialysis, blindness.
Okay, so those are really the endpoints or the events that we want to prevent 20 years down
Yes.
the road, but you're seeing some of these problems occurring even earlier.
Yeah, so we use a lot of non-invasive imaging tools to try to assess, are adolescents really at risk for cardiovascular disease, and do they have evidence of vascular dysfunction early on? So with some of the tools that we use are measures of carotid intima medial thickness, we use measures of pulse wave velocity, and we've done a large study in adolescents with type 2 diabetes in Cincinnati showing that adolescents with type 2 diabetes have greater stiffness compared to both their obese BMI match controls and as well as lean controls.
So it's a really unrelenting process that
Yes.
those problems just get worse.
Yes. So they're beginning in adolescence, and they're at risk for continuing on in the future probably as well.
Okay. Tell us a little bit about the research you're going to be presenting.
Sure. So we know that there are well-known established cardiovascular markers and risk factors, blood pressure, cholesterol, but what our lab is really focused is there anything we can do after reducing those risk factors? Because we know cardiovascular risk remains. We've taken an approach to focus on high-density lipoproteins, or HDL. HDL are essentially, or the high-density lipoprotein class is made up of many different subspecies, so it's not a single thing. And what we've focused on is, what are the types of particles? What do they look like? And do they give us any hints of that children with diabetes are at risk for increased cardiovascular disease?
So you're asking many of the same questions we are in adult cardiology, is that so once you've hit all the traditional cardiovascular risk factors, what's left? What drives this residual cardiovascular risk?
Yes.
And you've been able to determine that HDL may be a culprit.
Yes, so we've, our research has shown that adolescents with type 2 diabetes are deplete of a subspecies of large HDL particles, and we've shown this in numerous studies. We've actually shown that it's really related to the development of obesity and insulin resistance. But what some of our research is pointing to is that we actually may be able to recover some of these particles. So we had a study where we looked at adolescents after weight loss surgery. And we actually showed that, so in patients that had basically didn't have any of these particles, we're actually able to recover them over time. Now, we don't want to do surgery for all patients, and now what our research is really focused on is, can we use current therapies or other therapies to try to gain back these particles? So maybe it's diet, maybe it's exercise, maybe it's treatment of insulin resistance, and those are kind of the areas for our future work.
Well, I think your data demonstrates something really important, that some of this is reversible.
Yes.
We actually don't have to accept the
Yes.
chronic progression, and that there may be treatments on the horizon that may address at least these things that we think are treatable risk factors in this important population. So I'd like to thank you for
Yeah.
coming to Vascular Discovery and sharing your research with us, and thanks to all of you for joining us on this video.
Yeah, this is a great meeting, so I'm happy to be here. Thank you.